All right, so I'll first begin by having a round of introduction for the panelists.
Good afternoon. My name is Dr. Gilchrist Lokoel. I work for the county government of Turkana as the county director for medical services. Thank you.
Karibu Daktari.
Good afternoon.
Afternoon.
My name is Beatrice Buabi from Nairobi County NMS, Quality Assurance.
Welcome.
Good afternoon, everybody.
Good afternoon.
Dr. Mohammed Anif, Department of Health Services, Mombasa County, County Pharmacist.
Karibu Doc.
Okay. Good afternoon. Dr. Tindi Felix, Pharmacist, County Director of Health, Siaya. Thank you.
And finally, Dr. Masibo, the Director for Health for Nzoia County and the Acting Medical Superintendent for Kitale County District Hospital.
Thank you, and a big welcome to our distinguished panelists. So this first question goes to Dr. Masibo. I would like to ask you, what does sustainability mean from your perspective?
I think every time we encounter that word, people tend to think about resources, about finances, which is, according to me, or in my opinion, just one of the facets of sustainability. I think sustainability is also about the attitudes, the work ethics, the processes. For example, inSupply has been in our counties for a long time. Other than just investing financial resources, they have also capacity built the teams. And so there's a way they have been working. There's a process. There's a network in terms of how they do their work. And that also needs to be sustained. That's why some countries or some counties will be richer but will perform poorer, because the processes are not what they need to be. So even as we look to sustain in terms of resources, we also need to sustain in terms of what people have been taken through, what they understand those processes to mean, and how they can then pass over those work ethics and those processes to the next generation.
Thank you, Daktari. Can we also hear from Dr. Tindi on your understanding of sustainability?
Yeah, in addition to what my counterpart has talked about, again, building up on the gains which already have been set, probably we get these gains in collaborations with different partners who have the same interest. You also get gains from other sectors who also plays a key role on probably the area which we need interventions. And when these particular gains have been put into perspective and into use in now in question our counties and in respect to the Department of Health, how we sustain these gains using different processes, using different systems which have been put in place to ensure that the aspect, or in terms of financing and also in terms of equipping and in terms of capacity building on different areas, how do we ensure that the same system continues to produce the same output and even better output moving forward. So this can be from one particular, let me talk of one era to the next era, even with the change of different eras of management. The next era which comes into play to continue with the same, can they still continue implementing whatever the past era was doing? So that would be also another additional perspective. Thank you.
Thank you, gentlemen, from your perspectives at Siaya and Nzoia. Okay, next question I would like to ask Buabi. Nairobi County has been implementing the impact team approach for 2 years now. how do you think your county has integrated sustainability in the program design of impact teams? And if they haven't, do you have any suggestions on how they could have gone about integrating sustainability in the implementation?
Thank you very much, Anyona. Nairobi County, working together with the inSupply, has embraced the issue of sustainability in issues of impact team in 3 ways. One way that inSupply came in with was working with the existing structures. And the existing structures from the county, sub-county, up to the facility level has paved way for the county to follow up through those channels to make sure that the gains that have already been achieved will continue to be there even after this program has come to an end. And this came through the learning packages that the members of the impact teams were well trained, and the technical support from the inSupply empowered them to reach out to all our facilities and all the structures in place to make sure that this program has been owned at the root, at the service delivery at the root. And so we are sure in the county that even after a long time, we'll be able to mentor others in the same program and continue to even recruit the new members who come to the county to do the learning packages so that they get enough knowledge and skills to continue with sustainability of the project. Number 2 is the integration of different programs. When inSupply came in, we were integrated together, the pharmacy, family planning, immunization, records, and even some other programs were also put in, like nutrition. And so this teamwork is something that the county is going to count on when it comes into terms of sustainability, because we are now working as a team. We are embracing each other's expertise to make sure that we achieve our goals. And we are sure that even after a long time, we will continue to maintain what we have already gained. Number 3 is about the technical support. inSupply came in with technical support, and the technical support was rolled down to the sub-county and even to the facilities. Now all the facilities in our county have been empowered, and they are able to meet every month and look at their data, identify the gaps, have a change package, and work towards improving on their gaps. This is something that is already inbuilt in the facilities, and this is the way to go. And last but not least, the appraisal of the indicators. When we are appraising the facilities for the flagship indicators, we would like to know how the facilities are doing and what actions they have come up with and how they have put in the strategies to mitigate the gaps. So this is already done, and facilities are making their targets, and they are following up to find out on how they will be able to mitigate the gaps even at their level. This is one thing that has given us a lot of strength, and we are looking forward to see it grow even better after this. Thank you.
Thank you very much, Wabi. Very detailed explanation on how Nairobi County has integrated sustainability in the impact team approach. The next question I'd like to hear from the lake and the ocean. There's Lake Turkana over there and the Indian Ocean in the middle. Maybe we can start with Dr. Gilchrist. In Turkana County, inSupply Health has implemented a number of interventions, impact teams, C-stock, learning packages, potency, etc. So from all those interventions that we've been working on, what in your opinion has worked that you would like to continue, that you want to carry on and sustained beyond the project period?
Thank you very much, Dr. Anyona. You see, when you have, God blesses you with children, and then somebody comes and tells you which of the following children do you prefer, you see, you will be at pains to explain which one is your favorite, even if you know it exists. But sea stock has actually made a lot of impact in Turkana. This is a situation whereby, if you recall the earlier presenters who mentioned that the whole purpose of inSupply, previously JSI, was to ensure that how can these commodities reach the far-flung areas, hard-to-reach areas, while at the same time minimizing or reducing stockouts. So sea stock, in essence, has managed to build the capacity of those peripheral setups like Turkana, where we have 228 facilities. Of these 228 facilities, the ones that follow the main highway, they're actually very few. So a situation whereby you're having, timely reporting that is actually digital-based, and whereby we know at one point in time which facility is actually constrained with various commodities, and then we'll be able to take a corrective action at that point in time. It has actually made me comfortable because I can be able to serve the people of Turkana from wherever corners. Secondly, the impact teams, as they were, it has managed to create a consultative environment that is spanning from the community level up to the county level, where at any point in time, I am fully informed and fully aware of what exactly challenges exist in terms of commodity security and supplies. So by and large, the modules that also, the learning modules that were introduced, it managed to build the capacity of our people and be able to serve the citizenry and serve them better and faster. So by and large, yes, the inSupply, modules, the inSupply packages that have been brought to our county have actually played a big role, and we are happy.
Thank you. Let's hear from Dr. Hanif, please. What interventions have worked so that you wish to carry forward?
Thank you, Anyona, for that question. I think since we started, the impact model itself is a learning model for us. And bringing people together, different cadres, that actually exhibits the essence of multidisciplinary connection that needs to be there right from the county level up to the lowest level. So the impact teams have been able to own the data. The sub-counties have been able to own the data that is generated by the facilities within those sub-counties. So there is ownership, and with impact teams, they have been able to improve in the reporting rates, and the quality of data has also improved. But with that, there's also that intentional need, to follow up where there is a challenge, where there is a problem. So, and that ownership actually makes one person from that impact team to be able to follow it up on an individual basis. It's not somebody will do it, it's not my responsibility, nothing like that. Members take it up and they make sure that there's a follow-up done, intentional follow-up, such that there's improvement in the reporting rate as well as the data quality that is generated. Thank you.
Thank you, Dr. Hanif. All right. Next question I'd like to hear from Dr. Masibo. What do you think is the role of the county government on implementation of sustainability?
The county governments have, health is about the counties. Actually, they're the owners of health. So first and foremost, that is their mandate. But in terms of sustainability, especially of the activities around impact, I think we have a role in terms of even the coordination. A lot of the coordination has been done by inSupply hitherto. So it's important for the county now to start looking at how can we coordinate all the teams to continue doing the work they have been doing. We also need to look at leadership in terms of the very highest offices, in terms of the CEC, in terms of the chief officers and probably the directors, just getting involved and getting to know what is happening around in terms of impact teams. This morning, I think I was very, very impressed by the indicator tracking tool. And it's a tool that can be scaled up to even the highest management level. It's very simple for even the highest manager to understand. So I think that is one of the things we should also look towards doing. Of course, recognition. I think, I don't know about the other counties, but for Nzoia, I think we have lagged behind. All the recognition that has happened up to now in terms of impact teams has been done by inSupply. And that is one of the areas we need to look at. And it doesn't need to be very resource intensive. For example, when we are looking at competitive promotions, we can just say whoever has done the learning packages, it can be considered as one of the added advantages. So simple things that we can look at in terms of just motivating people to continue doing the work they're doing. The other area could be probably just creating awareness and recognizing the best performance as we have done today. I'm sure the counties that we are here today, the sub-counties that have been recognized, will be feeling motivated. And if we sustain that, then the work that has been going on will likely continue. I think in a nutshell, that is what I would say.
Thank you very much, Dr. Masibo. I think I'd like to hear now on the next question from Dr. Tindi. And also, Hanif, you can chime in. Who are the key stakeholders that you have identified in your journey of sustainability in your respective counties?
Thank you, Nyon. Stakeholders cuts across, and even as we look at the Department of Health, you'll realize that this is a department which greatly depends on collaboration to make headway in most of the interventions. And in regard to the budgets and the funding which comes across in this department, allocation towards the department is not, probably we can talk of not sufficient to carry out all the activities which are related to intervene in areas regarding health. And stakeholders are very key, and I would say that it starts with the reorganization within the department. And I'm talking about reorganization within the department because we do appreciate that we have a strength that in county government and also in government sectors, there's systems which are already in place. These systems just requires a lot to be done around system strengthening, so that different issues which needs to be tackled, which probably are weak, when they're strengthened, we can produce the maximum out of it. I've gone that way just to say or to bring across to the members that system strengthening within the department is very key. And when we start within ourselves, being the key stakeholder in all this, that will play a major role. Then now we can now look outwards and now look at other collaborators in terms of stakeholders. We have other government institutions within the county government, the other departments who are also key in the journey towards sustainability. You'll realize probably in regards to aspect of now technology, information and ICT, that is. Probably we'll have to collaborate with other departments to bring in that expertise into the department to solve some of the issues which we cannot solve as a department. So other departments play a key role, and they are stakeholders in the same. We also have a strong stakeholder in the national government as a key player in issues related to sustainability, because we'll always be looking at the national government in issues related to policies moving forward, and that is very important to the sustainability process. And just to bring across that I mentioned ICT and also the finance department. All those departments are very key around playing key stakeholders in this. And moving forward, we have other collaborators and partners who probably are not non-governmental, which we work with constantly. And I started by saying that health demands a lot of resources. And the non-governmental partners will always bring in that additional input across board, not only finance, but also other areas in relation to capacity building, which is very important. And just to finish on this, the community, again, the community we are working with, who ultimately these services get to, plays a major role as stakeholders. And one way or the other, when we get their input in relation to what are some of the things which as a department we've been able to give them, which probably they feel we can do differently. They play a major key in giving that information so that we can change probably the approaches which we have been using to reach out to them. Thank you.
Thank you. Dr. Hanif, anything to add to that list?
Dr. has taken all the limelight one. He has exhausted all the points. But just an addition, I think the facility in charges, they play a major role because they are the ones who are the supervisors of that facility, and they are the ones who generate the data that comes to us. Yeah, and they are the ultimate implementers of the policies and the guidelines that are formulated at the national level. So the facilities play a very big role, the facility in charges especially. Yeah, and the sub-county teams and the county teams, because of their oversight role that they play. Yeah, so they become important stakeholders within the stakeholding. You know, they are the stakeholders. Yeah, we cannot forget them. I think Dr. also forgot to mention probably the County Assembly Health Committee. That plays a very big role. Yeah, as Samburu County highlighted, you know, they had to take them out and, you know, to Nakuru, and they managed to get 50 M out of them. You know, you have to have the health committee of the county assembly very close to the department. Failure to that, we are doomed. Yeah, we have to have that political, you know, arm next to us. Very important stakeholders, because they are the ones who will push, you know, the budget of the health department to be approved. Yeah, the way it is. Yeah, so we have to have them close to us for any projects to be sustainable and successful.
Thank you, Hanif, for those additions. The next question goes to Madam Bwabi. You had mentioned about how Nairobi County had integrated sustainability riding on existing structures. Going forward, how will you monitor aspects of implementation to ensure that they've institutionalized? How are you planning to monitor?
Nairobi County is working on a partnership with the facilities. Facilities are like implementers. They are our eyes on the ground when it comes to service delivery. And so through the inSupply, we had that ITT, indicator tracking tool, which was mainly working through the DHIS. And the data that we were receiving for analysis was mainly retrieved from the DHIS. And so with Nairobi County is going an extra mile to have our facilities, all our facilities upgraded to EMR, whereby we will have accurate data, complete data, and data that can be retrieved at any time and can be analyzed, and gaps can be identified. So through this EMR, Nairobi County will be able to even follow up and see how the facilities are performing, how the indicators that matter in the county are performing, and in case there is any indicator that is not doing well, then there is that partnership of working together through support supervision, through OJTs, through capacity building, to make sure that these indicators have gone up. That is one way which Nairobi County will work through to ensure that there is evidence decisions which are made from the facilities in terms of giving quality service delivery to their customers. Number two, Nairobi County will also be using the appraisal form. All our facilities are appraised and they have targets on which they work against. So every facility has their targets, and at the end of mid-year, they are supposed to appraise themselves and see how much they have performed. So the county is able to follow up and see which facility has not done well through their appraisal. And this will also help the county to monitor whether the facilities are working towards the progress of improving the indicators or not. Number three is about resource. The county is working in collaboration with other stakeholders and also the service providers to make sure that there is consistency of supplies and also commodities. Because sometimes you can be having the people to work, you have the data, but you don't have the resources. And so you will find that there are some services that are not being offered. So Nairobi County is also working in partnership with other partners to make sure that there is consistent supply of commodities, and not just consistent supply, that the commodities are well managed to make sure that there is an impact in the service delivery. And the last but not least is about the community aspect. Nairobi County has gone ahead to recognize the work of the CHVs. And this is an aspect that is going to help the county to make sure that at the household there is service delivery and there is ownership of health. And we know when there is ownership of health at the household, then this makes health even easier. And so sustainability will not just be at the facility or the sub-county. It is coming from the household. And the CHVs have been motivated. The county now recognizes their work, and they are going to be given a stipend for what they are doing. And this puts Nairobi ahead in the service delivery.
Thank you. Thank you very much, Bwabi. The next question I'd like to hear from Dr. Gilchrist. I think the focus for today is how implementing partner projects are able to be sustainable. But I would like to hear from you in your perspective. Do you think government-initiated projects also need to have sustainability? And in what way?
Absolutely. If you look keenly at the way government does its operations, and I will narrow down to the county government, it does so through what we call county integrated development plans. These are 5-year plans that are actually packed and broken down into annual work plans. So the annual work plans incrementally feed into CIDP. If you again look at even the way it disburses its resources, it does so through what we call program-based budgeting, which is usually an extrapolation of 3 years of funding from this year. Then the next year, it feeds whatever you contributed this year, feed into next year and the other year. All this, in a broader perspective, it is feeding into Kenya policy framework, it's feeding into Vision 2030 and the social pillar. So government actually has all these plans that are ingrained on the sustainability that we are talking about. So it looks at the bigger plans, breaks it down into midterm plans, into annual work plans, and then into quarterly implementation plans. So that is how government looks at sustainability in that mantra.
So the question is, how can we support the facility in charges to balance with their conflicting responsibilities and roles at facility level in supporting the community health strategy?
From my perspective, I think facility in charges are the best placed at the community level, because they are the ones who are within the lowest level, the level 2s and the level 3s. And they are the ones who sit in those facility management committees where they interact with the, with the community, and the committees are the representatives of the community. So when they are negotiating, there's that interaction, and there is the explanation of what is happening within the facility. So the facility in charge, being the overall manager of that facility, they are the ones who will be able to interact with the CHAs, who are the link with the community and the CHVs. So that way, the facility in charges take up that role to be able to kind of be the oversight of the community activities, and they have that kind of one-to-one with the community leaders as well. So as much as they are doing their role, being the facility in charge, they can also be meeting the demands that come from the community.
I want to also say that it's not true that it's a conflicting role. Actually, the roles are complementary. The future of healthcare in Kenya or in the world is going to be private, primary healthcare. And facility in charges, as is rightly put it, are supposed to prevent things from going from preventive to curative. They have a role, a very big role. Some of the things he said, the facility, the community health units are actually linked to a facility. The facility in charge is actually the secretary to the health facility committees. So the two roles should actually be complementary rather than conflicting. And I think we need to find a way of the facility driving the primary health agenda so that it doesn't always deal with curative issues only. So from where I sit, I think it is very, very complementary and not at all conflicting.
Thank you. Thank you very much. Great question from the virtual participants. I think I'd like for us to close it at that point. Please, a big round of applause to appreciate our panelists. You are at liberty to take back. Thank you very much.